A deep divide. 59% of Americans reject RFK Jr.'s decisions as health secretary. Health Secretary Robert F. Kennedy Jr. faces a significant hurdle in winning public approval, with a recent poll revealing that nearly 6 out of 10 Americans disapprove of the actions he has taken in his role. But here's where it gets controversial. This approval rating isn't just about his policies. It's deeply tied to political loyalties and trust in institutions. The poll highlights an intense partisan split in how people perceive health information and leadership. For example, after former President Trump's September 22 comments cautioning against acetaminophen, the key ingredient in Tylenol, responses were sharply divided along party lines. According to a survey conducted the day after Trump's unusual press statement, where he advised pregnant women to tough it out and avoid the common pain reliever, 59% of Democrats labeled his claims as definitely false. Meanwhile, nearly as many Republicans, around 56%, believed his warnings to be either definitely true or probably true. What's crucial to understand is that no credible scientific study exists linking acetaminophen use during pregnancy to autism, despite these politically charged claims. In contrast, medical professionals continue to emphasize that acetaminophen remains one of the safest options during pregnancy, since untreated fever or pain carries its own risks. This poll provides a revealing snapshot of how dramatically public opinion and trust in health policies have shifted in recent years. Trust in the Centers for Disease Control and Prevention, CDC, for example, has taken a serious hit, particularly among Democrats. The poll notes a 24% plunge in Democratic confidence in the CDC's vaccine information over just the past 2 years, a decline attributed in part to the Trump administration's rollback of several CDC mandates. Traditionally, people have consistently expressed the greatest trust in their personal doctors when it comes to health advice. But Ashley Kurzinger, Associate Director of Polling at the nonpartisan Kaiser Family Foundation, KFF, points out that party affiliation now plays a larger role than ever in shaping whose guidance people follow, especially since RFK Jr. was named health secretary under Trump's leadership. Among Republicans, Kennedy has earned a trust level comparable to that of their own physicians, a remarkable shift given his controversial stance. Yet, despite this strong support from Republicans, Kennedy's overall approval rating remains low, with 59%, primarily Democrats and independents, expressing disapproval. This sharp divide underscores how diminished trust in federal health agencies is pushing Americans to seek information from vastly different sources. For example, Democrats tend to place America's public health landscape is becoming increasingly fractured. People are making health decisions based less on universal scientific consensus and more on partisan perspectives and varying sources of information. As individuals turn to different channels for health information, Kurzinger explains, partisanship is set to play an even bigger role in shaping what people choose to do about their health. This raises a burning question. In a nation so divided by politics, can health policy and advice ever be truly unified? Or are we on a path where medical decisions become just another battleground for ideological conflicts? Share your thoughts below. Do you trust health leaders across the aisle, or do political identities define your faith in their guidance?